roll. There we go. All right. Hey, everyone. Conversations on Vitality. AJ with me as always. Ariel Jarvis. Hey, Ariel. How are you?
Hey, I'm good. Today is the last Wednesday of October.
I know. I can't believe it.
So does
We
that mean we get to put up our Christmas trees next week?
kind of for,
Yeah.
for for us Christmas junkies. My Christmas music starts on Monday. It does.
Oh, I've already started. I'm like ready to go. I'm like carving my pumpkin while I listen to Jingle All the Way.
Nice. We're gonna get some backlash on this one. You watch.
Oh, absolutely. That's okay.
It's
Bring
okay.
it on.
Okay, gang. So this is our weekly Wednesday chat. We're going to talk about something something specific today that we haven't really focused on, a certain condition, and that is gout. And we're going to talk a little bit about what it is, what triggers it, what we can do to mitigate it through diet, nutrition, awareness, making some changes, and so forth. Now, Ariel, I don't know, as you know, I shared with you before we get on here, I don't really know much about gout. All that I know is we've talked a lot over the past months about inflammation, how inflammation is really the cause of a lot of our issues. And gout, in a sense, is inflammation of the joints, correct?
Yes. Yeah.
Okay.
Yeah. So yeah.
Give us an overview of what exactly is gout first, and then we'll dive in.
Mm-hmm. So gout is it's a type of inflammatory arthritis where the kidneys located in the lower back, that's your filtration system. Okay. So any liquid solution gets filtered through the kidneys. Any solid gets filtered through the digestive and intestinal tract. So what you drink or things that are a syrupy or a liquid constituent, that will go through the kidneys. So we really want to be mindful about how much sugar, red meat, or just all meat in general, seafood, and alcohol we consume, because we are overloading those kidneys, creating uric acid buildup, which then will crystallize. And then that crystallization will actually start to conjoin in the largest joints of the body. And the best way to know if you have gout is lower back pain and your big toe. The crystallization starts with the big toe first, and then it will start to move to the other joints of the body. And this is very, very painful. There's a lot of medications that you can take to help with the pain. However, you do need to correct your diet and treat the root cause, because the medication, unfortunately, is just a Band-Aid, and the crystals will keep forming if you don't get them out and change the diet so that they don't keep reoccurring.
So an uric acid buildup is really the culprit, or the thing in our body.
Yes.
The cause is what we put in. So question though, when we talk joints, so what is the difference between gout and arthritis when we have arthritic conditions in some joints?
Both are inflammatory. Anything that ends in itis is inflammation. So if you break it down into a particle science, it's too much positive charge in a localized area. And now it's creating crystallization, a little bit of acid crystallization in that area. And now the joint can't move properly. And the sensory receptors there are now signaling a pain receptor. So then you feel discomfort. There's so many different types of arthritis. Gout is your uric acid, which is a byproduct of too much protein. So there's different types. There's carbonic acid, which is a byproduct of too much carbs. So starchy things like potatoes and wheat and grains. A lot of people with, for example, with rheumatoid arthritis, that type of arthritis is more linked to carbonic acid load, which is the byproduct from eating too many carbs. Whereas gout is an inflammatory arthritis that is correlated with too much uric acid, which is a correlation with too much protein. So there's so many different types, and it's based on just not managing how much consumption of one specific food group you're having, because then the byproduct, remember, food is medicine, but you can overdose or underdose on that medicine. So it's not that, eating meat is bad, but if you're, say, for example, an athlete, well, as a bodybuilder myself, we're supposed to eat protein 4 to 5 times a day. And so what happens then is that's a little bit excessive than what we're supposed to have. And so an individual who is doing that will tend to have more uric acid building up in the kidneys, and they have to be more mindful about managing that. So it's actually kind of funny. You and I, we both did the switch. You went from being a carnivore to a vegan. I went from a vegan to a carnivore. So funny. And so just being really mindful about, if you are a carnivore, you can build up uric acid very quickly in those kidneys. So you do need to be mindful about managing that. And the way to manage that is, number one, observation. If you start getting lower back pain and pain in your big toe, don't wait till it gets too bad, because it will get worse. So start drinking ionized water to flush. So 4 liters a day. That's why they tell bodybuilders to drink a gallon of water a day.
Right,
Because you have to remove the uric acid. You have to dilute it. But ionized water is the best solution for the quick fix. And then we have here a formulation called K. It's not vitamin K. You don't want to take vitamin K. Our K is a concoction of Chinese herbs in a capsule. And what that does is it stimulates the kidneys to function more optimal, remove any acid buildup or uric acid buildup or crystallization in both kidneys, allow kidneys to function better. So people that are on dialysis, maybe their kidneys are only functioning a certain amount, maybe they have damage or kidney cancer. This supplement is for every single symptom associated with your kidneys, not just gout, but it does work amazing for gout as well.
So it's called K?
It's called K through
not
nature.
Not vitamin K, not special
Not vitamin
K.
K. Yeah, not special K, not vitamin K. And this is through Vitality Wellness.
Yeah, okay. Good to know. Now, protein. So protein intake, a lot of it can be the culprit, which rises the uric acid. So now we'll talk meat protein, animal protein. Are there some that are more cleaner than others in terms of what the effect on the kidneys is?
Absolutely. So
Okay.
Seafood is the worst and red meat is the worst. So those two culprits, I would just suggest stay away from if you want to prevent uric acid buildup in your kidneys. The ones that are a little bit cleaner, they don't produce as much uric acid as a byproduct, would be your white meats. So that would be the white part of your turkey, your chicken, fish, pork, those sorts of things, eggs. Yep. So those would be a cleaner protein. And that's kind of what, we recommend for our athletes.
Okay. Good to know. Now, the interesting thing is, being an athlete myself, I'm thinking, okay, I go through the warning signs, and you said the big toe. So the big toe is something that really seems to be a flag, waving a flag for gout. It's if it starts there 99.9% of the time, great. The lower back awareness can be tricky, and I'm just bringing this up because I think as a lot of us start to age, we generally have back concerns, issues. I mean, years of rowing. Yeah, every time I get up from the chair, there's a little bit of a creak and a little bit of a but the big toe, is it what it's funny just to think the big toe. What would be, is it just pain? Is it literally like a pain in the big toe?
It's excruciating. Like,
okay,
you want to chop your toe off. It's bad.
And
the reason why is because your kidneys, the big organs in the lower back, there's actually a main vein that runs along the growing down to the big toe. So that's where the uric acid crystal will start to transport, and not big crystals, little tiny microscopic, but then they build up in the big toe joint. And then eventually that crystal starts to get into it turns into a bigger crystal, because that capillary or that artery or that vein, because there's a whole bunch of them, will start transporting those little tiny crystals to that area from the kidney.
That is fascinating. So it's a fast track to the big toe.
Yeah. And you can identify which kidney is the one that has the uric acid buildup based on which toe hurts.
Interesting. I know. One of the comments we just got on our comment feed said wild. It's
Yeah,
like, yeah,
yeah,
it's pretty fascinating, but it's amazing to show like all the answers are right here.
yep.
Our body is a blueprint for cause and effect and treatment. Here's a question with crystals, like when we talk in the kidneys, oh my God, what's the condition where uh, you pass stones? What's it called?
Kidney stones. Kidney
Kidney stone.
stones.
Yeah, kidney stones.
Yeah.
Now, is that similar? Is it the same type of crystal buildup, just different type of crystals?
Yeah, that's a mineral buildup. So that would be like a calcium deposit. So
Okay.
mineral buildup. So that can be due to your diet. And so if you're taking supplements that are fat soluble, not water soluble. So for example, B vitamins are water soluble. If you take too many, then you will just you'll just pee them out. And your pee will be a very bright color, more
Yeah.
like a lime green.
Right.
But calcium, people need to be careful with calcium. Try to get it in food form because if you're taking calcium magnesium capsules, magnesium is water soluble. If you take too much, you pee it out. Calcium is fat soluble. It will crystallize in the kidneys. It's very painful, or in the gallbladder.
Mm.
And then now you have to pass stones. And sometimes the stones can be like the size of a toonie. Very painful. Very, very
Yeah.
painful. Not
Yeah.
fun. So
We don't
usually
know.
when it's that size, nothing can stretch that big. So
Right.
then you would have to get that surgically removed.
Right.
But if you don't want to have the downtime of surgery, taking K from our clinic
Okay.
actually decreases the size of the stone so that it's completely gone.
Wow.
So patients with kidney stones, we always tell them to take the supplement, and then it's depending on the person's weight, medications, or symptomology, we will consider a dosage for you so that you will have the most relief as fast as possible. Another inclination that your kidneys are not functioning properly is swollen ankles. If you have edema or water retention, I get a lot of girls coming in, not just girls, men too, but mostly girls, where they say, I don't get it. I work out every day, but I don't feel lean. I feel puffy. I feel swollen. And it's because they're holding on to water. Because
Mm.
remember, the kidneys is what filters out the water. But if there's too much acid buildup, it actually won't pass. All of it won't pass out of the bladder. And so what happens is your body holds on to water retention, but it starts with the ankles. And then you'll feel like your rings are really tight, things like that. And so you really want to make sure that you are constantly hydrating. People don't drink enough water. So 2 to 4 liters of ionized water a day. The
Mm-hmm.
reason why it has to be ionized is because your cells can only absorb negative charged water. Otherwise, you're drinking fluids, it's passing through the kidneys, but it's not removing any of the excess acid buildup in the muscles, tissues, and the rest of the body, which can be a contributing factor to edema, which is feeling puffy.
Okay. So the underlying thing here is water. We know ionized water is the game changer. In terms of gout, getting back to gout, this conversation, gout is brought on usually by a high protein diet, a diet rich in sugars, anything that raises the overall uric acid in the kidneys. And when we don't drink enough water to flush, to mitigate some of that acid, then it travels down and it lands in our big toe and and causes excruciating pain.
That's
Okay.
right.
Now, gout, here's a question. Can gout be eradicated in the body?
Yes.
Yeah. So it's something that can flare up and be excruciating, and then it can be dealt with and never happen again.
Yes.
Okay. Good to know. And then lastly, are some people more susceptible to gout? Is it also a hereditary condition, or is there a genetic predisposition based on the kidneys and things like that?
No, a lot of people think there is, but there actually isn't. It's actually just nutritional behaviors that get passed on,
Mm,
not genetics. And so obviously, if your parents feed you a certain way, you're going to create a nutritional behavior, and
right.
then you're going to feed your children that way, and so on and so forth. So we tend to see if parents have a high, if they're carnivores, usually the kids are carnivores, right? Or if they have a bad relationship with food, usually the kids have a bad relationship with food, or things like that. So
Yeah,
that's, we watch our parents, not to blame the parents, but
sure.
that is kind of, we observe that.
That's interesting because obviously that would be a really great conversation. There's so much about uh, generational nutritional influence, if you will,
Yep.
and then of course physiologically as well.
Yep.
And yeah, so it's kind of like a two-lane highway there. It's interesting. I never really, we don't technically think of passed on food behavioral or imprints, right? We usually just go to, oh, well, I'm genetically have a predisposition for this or that, or, so it's
Yep.
really interesting.
Yeah, I never like to say genetic, because you have to remember, people have traditions around nutrition. So let's say the Germans, they bring out their favorite dishes during the holidays. Well, that will be different for the English, or that will be different for the Russians, or you know what I mean? And
Mm-hmm.
so if you're constantly passing down nutritional traditions, then you might have a predisposition for an inflammatory disease or condition. Say colon cancer runs in the family. Well, how did that family tree eat?
Right. Ooh, that
I
stuff
know.
geeks me
This
out.
is good
I like putting
stuff.
my little geek glasses on, little
So
nerd
you can
glasses.
break those traditions, and you can break those, I call them nutritional curses,
Mm,
because you need to have a nutritional intervention. Why is there a link between every family member with heart conditions, or with colon conditions, or breast cancer? Why? Ask yourself why. Look at the eating patterns, look at the stress management, change your ways. You can break that cycle.
love it. Yes. All right. Awesome conversation. Some really great little sidebars too there today. That
I
was
know.
really great.
Thank you.
Gout. Again, Ariel, why don't you, if you could, just give us the K supplement, what it is, what it can help with, that we have at Vitality Wellness.
Absolutely. So we have a supplement called K, not vitamin K. It's a formulation of Chinese herbs in a capsule. And what it works on is breaking down kidney stones, helps with patients that are on dialysis, so that it helps so that your kidneys function better, and helps restore the kidneys. Can even help regrow cells for the kidneys if they are breaking down, or if there's kidney cancer or any filtration problems. If you have gout, if you have any arthritis, or anything that is affecting the kidneys or kidney related symptoms, this supplement is for you. And we encourage you to change your diet a little bit and just flush those kidneys so that they can work and perform for you. Ionized water is the key.
Awesome. Great. Excellent. Well, thank you, Ariel. As always, great conversation today, and thank you. We had quite a number of people tuning in. We'll make sure to get into the comments too. It's awesome. Thank you all for your support. Ariel, we'll see you next Wednesday.
Sounds good. Thank you so much.
All right. Mad love to the courageous, everyone. Cheers.